Next up, we have Wesli Waters with the Fairview Health Systems.
Thank you, Rika, for inviting me here today. My name is Wesli Waters, and I work at Fairview Health System. Fairview is a local nonprofit that has 7 hospitals and medical centers across the state. We also have 40 primary care clinics. We have several specialty care clinics, acute care, oops, I think it's cutting out. And then we also have long-term care facilities. If we look at Fairview, it's a large system, and we produce a lot of waste. When you look at our sustainability goals at Fairview, we've done a lot with waste reduction and recycling, and I'd say this is where we've really excelled, and this is what we've been doing our best at. If we look at, well, I'm going to go back, I guess, but if we look at healthcare as an industry, healthcare produces a lot of waste. Across the nation, that's around 5.9 million pounds of waste each and every year. To break that down into a more comprehensible number, that's around 33 pounds of waste per staff bed each and every day. So just imagine that if you're a patient in a hospital, whether it's Fairview or another one in Minneapolis or anywhere across the country, that's 33 pounds of waste that you're generating. That's compared to 4 pounds of waste for the traditional person in the US. This can be seen from the exam gloves, the gowns, the syringes, all sorts of different types of waste. And I'm not going to go into the complexities of the medical waste streams, but I'm really going to talk about how we've tackled this at Fairview. Again, looking at healthcare as an industry, it's in our best interest to reduce our environmental footprint and strive towards zero waste. If we look at the connection between environmental impact and community health, we can see that by improving our environmental impact, we're directly improving the health of our communities. And this ties very closely to the mission of healthcare. We're striving each and every day to protect and improve the health of our communities, so we really focus on how we can make that connection at Fairview. I'm going to just give one quick example of one thing we've done to reduce our waste, and this can be seen in our pharmacies. We have several pharmacies, and they ship temperature-sensitive pharmaceuticals to patients locally and then all across the country. Previously, before 2012, we were sending styrofoam shipping coolers to these patients. Well, as you can imagine, we started receiving tons of complaints asking, what can we do with this material? Will you take this back? Will you dispose of this for us? And as a result, we decided to form a task group to really research and find an alternative that would better suit our needs. As a result of this research, we found a compostable and biodegradable compostable cooler that has the same insulating properties as the styrofoam, but virtually has no waste. As you can see here, we have employed adults with disabilities to actually assemble the coolers. They ship the cornstarch materials to our facility, to our pharmacy actually. Adults with disabilities come in, they assemble the coolers, and then they transport them down the hall, pack them, and send them on their way. This biodegradable product can go into a backyard compost bin, and then the cardboard can actually be recycled. So it's a great alternative that we found that works very well for our pharmacy. We did see a small increase in cost, but we were able to engage our leaders and really talk about the benefits, and they saw that the slight increase in cost, the 1% that we were spending extra on this product, was really outweighed by the environmental performance and just knowing that we were really doing the right thing. And finally, we were the first healthcare system in the US to implement this type of shipping cooler. As you can see here in the photo, this is just an example of the styrofoam that we're eliminating. Up to date, I think we've eliminated over 200,000 styrofoam coolers from our patients' waste streams, and we've received a lot of thanks and gratitude for that project. This picture just shows what we go through in about 3 to 4 months, so you can only imagine how quickly this starts to add up. And in conclusion, I just want to leave you with a few things. I would say that the first thing would be, even though Fairview is not a zero waste organization, I think it's important to tie zero waste and then sustainability initiatives to the mission of your organization. At Fairview, we've really tied sustainability to our community health impact, and we've had a lot of success with engaging our leaders and getting stakeholders involved, and without the connection between community health and environmental health, this project would probably not have existed. And then the second takeaway I would recommend is really just think outside the box. I know that's super cheesy and cliche, but this project, if we hadn't spent a lot of time researching alternatives, this may not have happened. And a lot of the projects that you are working on here today, and as we've seen in several of the other presentations, these are things that just haven't been done before. And it's not really going to be easy. So I would just remind you that it's important to continue to think of those creative solutions, knowing that you'll have a substantial impact on the environment.